Hello friends, I'm presenting a success story of a fetal subdural collection. We present a case who was referred to us at 32 weeks of gestation for a second opinion for the fetal brain. There was no history of trauma, infections or any coagulation disorder. While looking at the ultrasound features on a axial section of the fetal head, what we saw was at 32 weeks there was a curvy linear echolucency which was seen as a subdural fluid observed along the left cerebral hemisphere. Rest of the fetal morphology was absolutely normal. So we began with the monitoring of the baby and close antenatal follow-up ultrasounds were done, which were to see the size of the collection. So she comes to me at 35 weeks of gestation. We saw the persistence of the subdural collection with mild midline shift to the right. And her MCA Doppler was normal. Following that, she underwent an MRI where on both T1 and T2 weighted images showed us an extracerebral subdural collection in the left frontoparietal region as denoted by the star with mild midline shift. So what about the outcome of the patient? At 37 weeks of gestation, an elective CS was undertaken to reduce the potential delivery related risks. Following which a male neonate was delivered with APGAR scores which were absolutely normal. Throughout the hospital stay, the infant remained clinically stable and asymptomatic, and routine neurological assessment of the baby was also absolutely normal. Following which a postnatal evaluation was done with a transcranial ultrasound which confirmed complete resolution of the subdural collection with no evidence of hydrocephalus or brain compression. So in this situation, whenever we come across such a kind of entity or we come across such subdural collection, it's very important to undergo a certain workup for this particular patient, which includes excluding the possibility of maternal trauma because the head is very close to the maternal abdomen. Also, we need to look into maternal conditions, whether the mother is taking warfarin or she has sickle cell disease or idiopathic thrombocytopenic purpura. On the fetal side, we need to exclude the possibility of fetal coagulation disorders like fetal alloimmune thrombocytopenia, and also we should recommend a fetal brain MRI which is reassuring and also looks at the other areas of the fetal brain. We also need to ask the couple to consult with a neonatologist and the neurosurgeon if at all required. So after all this is done, our patient had no antecedent factor which contributed or attributed to the cause of subdural collection as seen in our case. Close monitoring and early delivery by CS may be required, and mostly they are idiopathic and show spontaneous resolution postnatally. Thank you very much. Please like, share and subscribe my channel.